virus is upon us with a rapid viciousness like we haven't seen before.
Hospitalizations hitting all-time highs.
Wear your mask and wash your hands. Somebody else's life could depend on it.
ICU beds filling up fast.
We are becoming anxious about whether we will continue to provide care to everybody who shows up into our facilities.
The rapid spread alarming state health leaders.
And I am particularly worried about our hospital capacity.
The count is so high, contact tracers are overwhelmed, forcing them to prioritize cases in some local counties.
For us not to be able to contact individuals, it's hard.
You play a role in how the numbers fluctuate.
Each individual person has the capacity to impact next week, next month, February, March.
The Piedmont Triad is in a COVID crisis. And it's a crisis that'll become more critical as we head into Christmas next week.
And we are dedicating the next half hour to take an in-depth look at how the coronavirus is attacking North Carolina. We have these top leaders at 3 of the Piedmont Triad's largest hospitals joining us for this commercial-free special. You will hear how critical things are at their facilities in just a moment. But first, we want to take a closer look at the danger North Carolina is in right now. This color-coded map the state updates every other week shows most counties in our viewing area are in the red or critical category. Not a place we want to be, especially as we learn COVID is a seasonal virus. Winter creates major worries for healthcare providers and state health leaders.
These numbers are another huge concern. We have now hit more than 451,000 cases here in North Carolina. 5,273 are new today, and 2,800 people are hospitalized. 821 of them are right here in the Piedmont Triad. We're talking patients in medical facilities where ICU beds are filling up by the minute. And just take a moment to think about that and what it means if you or a loved one has a medical emergency.
Hospital leadership is constantly looking ahead to worst case scenarios and doing all they can to provide the same level of care expected, whether you are a COVID patient or not. At some point, though, something may have to give.
We want to bring in our team of doctors now. Joining us tonight, Dr. Bruce Swords, the Chief Physician Executive at Cone Health, Dr. Eric Summers, the Chief Medical Officer at the Wake Forest Baptist Medical Center, and Dr. David Priest, Senior Vice President and Chief Safety, Quality, and Epidemiology Officer at Novant Health. Dr. Swords, let's start with you. We saw you in the opening to this broadcast saying you're anxious. When it comes to COVID, how full are your facilities? What are your staffing levels? And are you at the point where other care is being affected?
Well, first of all, good evening, and thanks for the question and allowing us to participate in this panel. In regards to how many patients we have and what our staffing is like, I like to compare this to what it was a few months ago. And so I have said for several weeks now, September 20th, we had 35 COVID positive patients in our hospital, and right now we have over 200 COVID positive patients in all of our facilities. And so that's really the concern, is the rate of rise over a short period of time and what that might mean into the future. And our predictions are that there will be continued increase in COVID patients. To date, we've have an incredible team who's completely committed to taking care of patients. We have appropriate staffing, but if our predictions come true, we may have to limit some care that is not as time sensitive and urgent as taking care of COVID patients.
And Dr. Summers, we know you recently saw your 1,000th COVID patient leave the hospital. What is your capacity looking like, and what are the biggest challenges for your team right now?
Thank you. Much like Dr. Swords, we are having challenges with capacity, especially in the ICU setting. In Forsyth County, since the end of October, we've had a 300% increase in COVID-19 patients hospitalized. We were at 136, now we're at 347. That's tough because it makes it difficult to get the patients in that we need to take care of. The good news is that we're working together on this. This has been a great moment of Novant Health, Cone Health, and Wake Forest working together daily to get our patients in where we need them. We worked today, we had 8 ICU patients out in the community, Caldwell County, Yadkin, Davidson, Guilford, to try to find a place for them. So things are tight and it's concerning. The other concern is that we've got Christmas and the holidays coming, and we saw a jump around Thanksgiving, and we don't want to see that jump in Christmas, because if we have another jump, the reports from UNC and Duke report came out that the first week of January we may have no beds in the state for ICU patients. So we've got to shift that curve. We got to get the cases down, and I think that's going to be a team effort beyond just our hospitals. The people that are watching this, the community, we've got to mask up, keep our distance, and keep our hand washing up.
Yeah, just an amazing prospect, the prospect of no beds after the first of the year. Thank you, Dr. Summers. Now to Dr. Priest, Novant Health. And Dr. Priest, I understand there have been a number of operational changes within Novant for surge planning. What are some of the hurdles you and your team are facing every day, and how can people in the community help?
Yeah, thanks, Neil, and thanks for having us on as well. I will say and echo what my colleagues have said about hospital volumes across our system. We're having unprecedented numbers of COVID-positive patients. In our system as a whole, we have over 450 of those patients in our hospitals across North Carolina, and that's a real strain. Now, from the beginning, we had major surge planning. We planned for 10 times our patient volume when we first started the pandemic back in March. And by preparing, we did, we made sure we had the staffing we needed, the personal protective equipment we needed. We also made sure we had the IV poles and the ventilators, and we've needed all of those things. Like other hospital systems in our region, and we've had to put a pause in the triad on elective surgeries. So those are surgeries that are not time sensitive, that could wait, because we've got to have those resources to take care of patients. I think, as I'll echo what was also said about the role of the community, it's very important that people mask and wash their hands and be socially distant. And I think when you think about that thing, or think about those comments, we've all heard that. We've heard it for months and months and months, and I think it's almost just become this refrain that people aren't paying attention to as much anymore. And hopefully events like this will change opinions. I hope when people think about what they're doing day to day in their activities, I try to frame that in a way that they can maybe think about it in a different way. So people all the time say to me, hey, what can I do this particular activity? Is this something I should be doing? And I said, look, there are a few things you need to think about. What's going to be going on there? Are people going to be singing or yelling, or are they going to be talking loudly? What kind of space are you going to be in? How many people will be there? Is the airflow good? Are people going to be masking? And you can imagine places where you can't do those things, like bars and restaurants and places of worship that aren't taking COVID precautions, are going to spread the virus. So if you're thinking about, hey, do I have a risk of getting COVID doing this particular thing, keep those things in mind and avoid them if you can. Make sure you have plenty of space and there's good airflow and there are not too many people in the space and you're not there for too long. And you're masking, and that'll protect all of us so that our hospitals have the resources they need to care for the sick.
Dr. Priest, thank you so much. And it's important to point out that when we talk about numbers and statistics, we are really talking about people. They could be a family member, a friend, or a neighbor. These are some of the lives nurses and doctors in the Piedmont have saved over the last 9 months. Each patient has suffered through a different experience, a life-changing experience, not only for them, but for their families. Some know how they got COVID, others do not, but each person remembers the symptoms that sent them to their local hospital.
For Carl Booker, it was a cough that made him feel like he was choking.
I mean, I saw the numbers. I know people were dying from it, but, I refuse to be one of them.
Booker got himself to the Wake Forest Baptist Medical Center December 5th and tested positive for COVID. He was also diagnosed with pneumonia. He was at the hospital for almost a week, needed oxygen, but is home tonight feeling good. And he told us he always wore a mask, only went out when necessary, but did share his 16-year-old son tested positive shortly after he did.
This is a survivor story we captured at Novant Health in October. You heard the cheers and there were plenty of tears because this young lady almost lost her life. 25-year-old Tiana Hairston coded for 30 minutes as she fought COVID and suffered strokes and a heart attack because of it. She caught it while caring for her mom, who tested positive, and at one point her mom was getting ready to say goodbye.
They thought that we should take her off of life support because she had no hope for life. They thought she would be a vegetable. She wouldn't have any quality of life at all.
Thank you guys for being there for me and supporting me.
And we checked up on Tiana today, and her mom tells us she is improving every day. She's getting around with the assistance of a walker. Her memory is improving and her appetite is great. Tiana told us she is feeling good, and mom still believes she will make a full recovery. They plan to celebrate life this Christmas, appreciating having Tiana with them. Hospital stays for COVID really vary. Some need care for days, weeks, and for others it can be months.
Months alone, unable to communicate or connect with the people you love. Well, a man from Guilford County spent 3 months at Cone Health getting care.
I'm just a whole lot more thankful for being here and thankful for my family.
Thankful because 6 months ago, Ronnie Coltrane's family didn't think he would survive COVID. The family leaning on hope and God, which led to this moment, reuniting in the hospital hallway after nearly 80 days apart.
The hospital said that Ron was the worst case they've ever had. And the person, he's the worst one that's ever survived. You know, he was the sickest one they've ever had to survive. And I just want to tell people out there today, there's always hope.
Worth repeating, there's always hope. Ronnie is enjoying his life a little more as he works to fully recover. We spoke to his wife a few hours ago. She says having him home is the best Christmas present she could have asked for. Well, after months of waiting, there is now a ray of hope in this deadly pandemic, a vaccine. It's not available for everybody right now, but it is a start to saving lives. This week, the first shipment of the Pfizer vaccine hit the road. Novant Health and Cone Health are expecting their doses tomorrow. The Wake Forest Baptist Medical Center got its shipment on Monday. We were there as Wake Forest Baptist infectious disease specialist Dr. Chris Ohl got his first of 2 required doses. And here's a picture of Dr. Summers getting his.
And here's a look at the supply in the first allotment. The 3 biggest healthcare systems in our area will get nearly 3,000 vaccines. Again, this is just the first shipment. On Friday, we're going to learn the number of new doses the state will receive, but it is unclear which hospitals will get them.
All right, let's go back to Dr. Summers. Dr. Summers, we had a picture of you getting your shot yesterday. I got to ask you, how do you feel? Is your arm sore? Do you have a fever? Have you felt your immune system kick in?
Yeah, well, first off, I'm not a fan of shots, that's for sure. But if I hadn't looked when they were giving it to me, I don't think I would have realized I was getting a shot. It was so easy. I felt nothing. Later that night, I did go to bed about an hour early. I just felt like I needed to go to bed a little early. This morning, my energy was fine. I did notice a little kind of, not pain, but soreness in my shoulder. But yeah, it went great. And it was amazing how easy it is. And just an effective, wonderful opportunity for our community to get this vaccine. It's, and you know, that they asked me,
I'm sorry to interrupt you there, Dr. Summers. Did you have something else to say very briefly?
Well, yes, I just wanted to say that the reason people ask me, why did I get this vaccine? And you know, I wanted to share how easy it was with the community, but I also wanted to tell everyone that this is about, I got it for my family. I don't want my family to get this. I got it for my neighbors, the people watching today, loving thy neighbor as thyself. And I want us to get back to where we were before.
Yeah, no kidding.
And I think the vaccine will absolutely do that.
Yes, we all certainly want that. Dr. Summers, thank you. Well, Fox 8 viewers have been listening to medical professionals say people with severe allergies may have adverse reactions to the vaccine, and they want to know what those severe allergies are and what the reactions might be. Well, let's go back and take a look. We know this new vaccine is new. It'll take months before the general public gets it. And here are the phases for getting the vaccine. Right now we're in phase 1A, and it'll be phase 3 or 4 before we all start to see it. Let's go back to Dr. Priest of Novant Health. Here's a question from one of our viewers, Dr. Priest. If a person qualifies for the vaccine in phase 1B, will his or her whole household get it at the same time?
Yeah, I think that's a good question. I think what the state's plan is that individuals will get the vaccine based on the phase that they're in. So it wouldn't be based on their household. So for instance, if a member of your household qualifies for 1B, meaning they have a couple of different chronic medical conditions like diabetes, then they would qualify. The other members of the household would get it only when it's their turn in terms of the phases.
Here's another question from one of our viewers who wanted to know, what is the projected time for the vaccine's effectiveness, and will it be an annual shot? Dr. Swords, what's your take on that?
Good questions, and there's a lot of information we don't know about the vaccine and its longevity as far as its protective effect. We do know that when people get the first immunization, Dr. Summers' immune system will kick in over the next several days. He'll get another shot in immunization in 21 days, and then the data behind these immunizations is fantastic, over 90% effectiveness. How long it lasts, we really don't know. These, I believe the first trials of this Pfizer vaccine started July 27th, so that's 4.5 months ago. So there really hasn't been time to understand how long immunity lasts or whether folks will need another immunization in a year or 6 months or never. So that information is yet to come.
Here's one more question for you, Dr. Swords, from one of our viewers. Should a person who's already had COVID-19 get vaccinated?
It's another good question, and we don't know for sure. We would not recommend, at least now, we think those folks who've had COVID within the last 3 months retain their immunity. There'll be more information to come, but perhaps after they've recovered for 3 months, they'd be eligible, but not in one of the first phases.
All right, Dr. Swords, thank you. And as we mentioned, healthcare workers consistently interacting with COVID patients and directly treating them will be getting the first doses of the vaccine.
These men and women have worked tirelessly, many sacrificing so much to treat COVID patients. Some have been distancing themselves from family since March when this pandemic started. Bob Buckley takes a look at some of the heroes in this crisis.
Every health professional knows they may face difficult situations. Few anticipated the war they were drafted to fight against the COVID-19 pandemic.
It would have been easy to opt out. It would have been easy to say, you know what, I'll let somebody else do it.
For relatively new nurses like Cameron Howard,
baptism by fire for you.
Especially the past couple of months. I've seen a lot.
I think that we all feel like we're lifelines for our patients.
That's exactly what we become, is their surrogate family.
A family is what the healthcare teams at Cone, Novant, and Wake Forest Baptist all feel like.
And I've seen staff get COVID. They've been out for a week or two and they come right back. You know, I've got to help these patients. And that, you know, you can imagine that makes me want to go to work. That makes me want to help people.
Doctors say this is one disease you don't want to fight by building herd immunity.
We'd rather get that immunity through a vaccine than from actually acquiring the infection, because acquiring the infection is dangerous. It may put you in the hospital. It may kill you.
An idea that hit close to home for Wake Forest Baptist nurse Jay Perales-Avila.
My mom had COVID. And it was tough.
But these workers wouldn't miss this battle for anything.
We have one nurse that says, how could I look back in 20 years and say, I sat this one out?
This is something that our team will never forget.
Well, hospital beds filling up, a big concern across the state of North Carolina, but especially here in the Piedmont Triad.
People will be working the holidays to care for you 24/7, a time when health leaders fear hospitalizations could just skyrocket. Let's bring our doctors back to discuss the numbers they are expecting and preparing for at their hospitals during the Christmas and New Year's holiday.
Yeah, no doubt about it. This is a key time for people to gather in groups. So Dr. Summers, we'll start with you. What advice do you give churches that are thinking about holding holiday worship services?
Well, thank you for that question. First off, we need church right now. We need church. We need prayer. We need that. And what I would say is to the leaders of the churches in our area is that first, keep your parishioners safe. Keep the vulnerable safe. Make sure they're wearing masks and they're keeping that distance. They're washing their hands and you know, this reminds me of a couple that I took care of a few weeks ago, who churchgoers for many years, and they picked up the virus, and I don't want that. I don't want to see that. For the parishioners, I know that you're probably missing the fellowship, the singing, the hugging, the dancing and the shouting. We're going to get back to that, and that's the good news. It's coming, but we need you to stay strong. Stay strong with this. Keep it up with the restrictions. Get that vaccine, and we're gonna celebrate later when this all goes away.
Thank you, Dr. Summers. And Dr. Swords, you've used the words urgency, emergency, close to a crisis. How do you describe what you are expecting for the holidays, and why is COVID so prevalent in the Hispanic and African American communities?
I'll take the first question, and we do expect, as we have seen with every other holiday during this COVID era, that numbers will go up in our hospitals related to COVID-19. And we have predictions that we may see our numbers increase from 200 to 400 over the next 4 to 6 weeks. And a lot of that has to do with people gathering together, going to church, visiting family members. And I agree, we're used to doing that. We like doing those sorts of activities, and this year is the year not to do those things. As tough as it is, I do think by next year we'll be in a much more familiar space after the vaccine takes hold. In regards to African American and Latino populations, there is a long history in our country about systemic health inequities, and we're seeing more of that now with COVID than we have. Well, we see that all the time, and we're seeing it with COVID. And there's a lot of things that go into that, lots of social determinants. People who are in those populations may have more chronic diseases such as diabetes, hypertension, congestive heart failure, and there's also a likelihood that those populations are not able to socially distance as well as others, and perhaps live in multi-generational homes and transmit the illness more readily than other populations.
All right, now to Dr. Priest from Novant Health. What is your staff there at Novant preparing for over the next few weeks based on trends at your facility, and how often do you suggest people get tested?
So another good question. We have planned for the surge from the beginning. We have models and fantastic clinical data teams within our organization that make predictions and help us predict based on COVID activity in our communities. And so we also predict there will be increasing numbers of patients who need hospitalization in our hospitals. And I think we've seen that now. We're in the Thanksgiving surge now. And to the points that have been made earlier, when you start to move into Christmas, you have those same kind of gatherings, and you can have the same risks we had at Thanksgiving. They tend to be a little more spread out at Christmas rather than a single like Thanksgiving weekend. Now you have around Christmas, you have New Year's, so all of those are gonna lead to additional surge, and that surge will probably drag into January. In terms of the question on when to be tested, certainly anybody that has symptoms consistent with COVID, so fatigue and shortness of breath and fever and cough, sometimes gastrointestinal symptoms, certainly should be tested. In addition, individuals who have been exposed to cases or people you think may have had COVID should be tested as well. And those folks who don't have symptoms who've been exposed should be tested on about day 7. After that exposure. I'll echo the comments earlier about trying to hold on through this period of time. in my mind, it would be silly to get COVID and tragic to be hospitalized or certainly to die from COVID when you're just a few weeks from having a vaccine that would protect you from getting it. So I would think about it in that context and maybe say, hey, you know, we're going to have our family get together, but we're going to really shoot for the summer of 2021 when we can be vaccinated and we can travel safely. And that would be the best thing. I know it's hard.
Yeah.
I haven't seen my extended family in a year. I haven't seen my mother in a year. And that's really hard. We don't like that. We don't want to do that. But I'm protecting her until we can do this safely, until we can all be vaccinated.
Yeah, let's not gather this year so we can be with our loved ones next year. We want to thank all of our doctors for joining us tonight and helping our viewers really understand the impact of the virus and the critical need for everyone to do their part to get things under control. Gentlemen, it's been an honor to be with you tonight again. Thank you. As we say goodnight, we remember those who lost their fights with COVID here in the Piedmont.
Our thoughts go out to all of them.